Those of you who were with us last night will have heard fulsome praise for the Italian government, really, which has done so much, not just within Italy now, but now with the presidency of the European Union. We were hoping that the Italian Minister of Health would be with us today. She has had to pull out, but I tell you, not from lack of commitment. There's actually a rather good reason why she's had to pull out. But she has sent a message, and I'm delighted to welcome her representative on earth, as it were, Dr. Marco Spizzichino, who is going to read her message for us. Dr. Spizzichino.
Buongiorno a tutti, vi leggerò il messaggio del Ministro Beatrice Lorenzin.
Good afternoon. I would like to read the message of our health minister. First, I would like to say hello to all the authorities and the participants of SIP and all the therapists. You're here to help us reach one of the presidency's objectives, that of creating a model which offers a multidisciplinary assistance to the patients who undergo palliative care and pain therapy through a network. This is the possibility to make proposals and to improve the treatments in Europe. As you know, the European ministers spoke about the Italian experience, and everyone realized that it's difficult to guarantee an adequate assistance to patients with incurable diseases and chronic pain. There are patients, 35%, who have pain every day, and patients sometimes say that the pain is so intense that they wish to die. For 26% of patients, it has had an impact on work. But 56% have severe pain, but only 41% receive opioids. Law 38 defines aid networks and organizes models to be applied to pain therapy. But since this organizational model is not available everywhere, we need people to be committed to work next to people who are ill. I would like to remind you the main points of this EU meeting. They spoke of the necessity to create networks of palliative care, which take into consideration the need of the pediatric system. They speak of the creation of an information system for monitoring these networks. They speak of the need to guarantee access to painkillers and opioids for all. They also spoke of creating 2 European days, one for palliative care and the other for pain therapy. Everyone says the citizens have a right to avoid suffering. That's what Article 1 of our law states. Our priority is to defend patients' rights and to avoid useless suffering. Have a nice day, and may the conference be very successful.
Io volevo fare anche delle
Yes, I also wanted to make a few comments.
la possibilità di parlare in italiano.
And I'll take advantage of the possibility of speaking Italian. On the previous panels, you've spoken of training, and training is obviously very important, but I don't want it to be merely a medical training. Thanks to Cittadinanza Attiva and another association and regional agency, we carried out a survey to see which hospital units are more human. They saw that it's the pediatric section as well as the pain unit. This means that our training is not linked only to learning to be a doctor, but learning to be a person who respects people. So I think that in the courses, in the training courses, you need to teach people to be more human. And then there's another important aspect in our law. There's a specific article which creates an obligation for all hospital structures to measure the patient's pain levels when they arrive. This is an obligation. They have to measure the level of pain. They have to assign a therapy and then measure the final result. Now, why is this article useful? It's useful because it has a legal value. So if a patient arrives and the patient knows about Law 38 and his pain levels haven't been measured, then he can go to the police. As I was saying, it's a law, and that gives it a greater strength. Then another point I wanted to bring up is the economic aspect. As the representative of the Commission was saying, in a moment of spending review to European level and cuts, economic issues are important. And the first thing we can do is to establish a project of health technology assessment on the basis of Law 38. Let's measure the results. Let's see how much we are saving thanks to our actions in palliative care and pain therapy.